concerns have been raised about the drop in the number of people getting the vaccination for shingles just 5 years after it was first introduced.
Yeah, Public Health England say around 200,000 eligible people didn't take up the free vaccine in the last year. So let's get more details now from Mary Ramsay, who's Head of Immunisation at Public Health England. Mary, morning to you. How worried are you by these figures?
Well, we're not that worried because there is still time for people to get the vaccine. It doesn't have to be at a particular time of year. So what we're trying to do is encourage people to get vaccinated if they're in the right age group. So it's people aged 70 and 78 who are eligible. And if they've been eligible over the last 4 or 5 years, they can still get it up to the age of 80.
And can you just explain what is shingles?
Yeah. So shingles is caused by the virus that causes chickenpox. All of us get chickenpox as children, and then the virus stays in the body. And as you get older, if your immune system sort of drops at any time, you can get this painful rash, which is called shingles. It's usually on one side of the body. It can be the chest or the face, and it can have some quite nasty complications. And one of the ones we worry about most is this prolonged pain that can go on for weeks, months after the rash. And it's particularly common as people get older, so that's why we target people aged 70.
Are we getting a bit complacent? We think it's gone away, and therefore we don't really hear the headlines about it, we don't really see other people with it, so we think, actually, I don't need to get that immunisation after all.
Well, I think shingles is a bit different. It's not a disease that comes in epidemics. It's something that you have as a child and then you can get at any point. So it's not something that'll ever really go away. For those people that age, they've had chickenpox, they're always going to be at risk. The issue, I think, is that this is a vaccine for older people, and I think most people think immunisation is about children, and of course in childhood our vaccine coverage is very high, and vaccination is just seen as a normal part of kind of growing up. We want to make it also something about growing healthy, staying healthy as you're older as well.
Are there any side effects to it? Because that's what sometimes people worry about when they're getting jabs, don't they?
Yeah, I mean, very occasionally it can cause a mild little rash around the site, and there are a very small number of people who can't have the vaccine if they've got an immune problem because they're on, say, drugs for steroid drugs or drugs for cancer treatment, or they have had leukemia, then they shouldn't get the vaccine. There's about 2 or 3% of the population that shouldn't get the vaccine, so it's obviously important that you check that with your doctor first.
Is it something you're told you need to get, or should you proactively be going and thinking, right, I'm the right age, I better go and get my shingles jab? How do you know?
It's a bit of both, really. So, I mean, that age group are generally going in and out of their doctors quite a lot. Yeah. And when we started the programme, it was given kind of alongside flu, which is given to everybody over 65. You do get called in for that. But because the coverage has been dropping a bit, we're trying to encourage people to actually be a bit more proactive and not wait until the flu season to go in at any point during the year. As soon as their birthday, they can go in and make the appointment.
So some practical things then. Who can get it, where can they get it, and how do they ask for it?
Okay, it's all through your general practice. It's basically people who've turned 70 this year or turned 78 this year, and then anyone who was in those age groups for the last 5 years since it came in.
Right.
So almost everyone between 70 and 79 can get it, but there's a 2 years age group that will have to wait over the next couple of years. But if you go to your GP, you can make an appointment, and the practice nurse will usually give it to you within a week or two.
Yeah. Mary, thank you very much for coming in to explain that
to us.
It's Mary Ramsay, Head of Immunisation at Public Health England.
Let's take one last look at the weather this morning.